Afternoon. Welcome to today's Wisconsin Health News virtual briefing on what's next for AI. My name is Tim Stum. I'm the editor of Wisconsin Health News. Thanks to all of you for tuning in. We have a really great panel with us today to talk about this important and fast evolving topic. I'm thrilled to introduce Yoon Chung, Dean of the College of Nursing at the University of Wisconsin Oshkosh, Dr. Dave Newman, Chief Medical Officer for Virtual Care at Sanford Health, and Dr. Brian Patterson, Administrative Director for AI Initiatives at UW Health, and Seon McGunigal, Director of Artificial Intelligence at Epic. Thank you all for sharing some of your valuable time with us today. Before we get started, I want to make sure we thank our generous sponsors of the Wisconsin Health News virtual series. Healthcare leaders from across the state sign up to watch these virtual events, and they would not be possible without the generous support of our sponsors. So a huge thank you to Aurora Healthcare, AARP Wisconsin, Anthem Blue Cross and Blue Shield of Wisconsin, Delta Dental of Wisconsin, Amplify Health, and Quartz. Wisconsin Health News is an online, nonpartisan news service. In addition to hosting events like this, we also publish a daily email newsletter. If you're not yet a subscriber, I encourage you to sign up for a free trial, which you can do on our website at wisconsinhealthnews.com. And I want to give an extra thanks today to Quartz, today's featured sponsor. We are really grateful for all of their very generous and continued support. Here to say a few words is Siva Balu, Chief Information and Digital Officer for Quartz.
Thank you, Tim. And good afternoon, everyone, for joining today's important conversation. I'm honored to represent Quartz as a featured sponsor and to help open this timely discussion on artificial intelligence in healthcare. For those who may be unfamiliar with Quartz, we are a locally based, provider-owned, community-focused health insurance company serving members across Wisconsin, Illinois, Iowa, and Minnesota. For over 40 years, we have partnered with leading health systems like UW Health, Unity Point, Amplify Health, and Advocate Aurora Health to deliver high-quality, affordable care. I recently joined Quartz as the Chief Information and Digital Officer, primarily because I was drawn to the mission of the company, to the investment in innovation that really is driven with purpose. Our mission here at Quartz is to ignite the power to create a life well lived. Every day, our Quartz colleagues and partners work very, very hard to make our community healthy. And this is what drives us here, using technology, digital data, information security to really transform the experience of our members and customers and patients. At Quartz, we see enormous potential in the power of AI and digital tools to expand access, to improve risk prediction, personalize care, anticipate member needs, and above and beyond, make sure that our members, our communities have a healthy, seamless healthcare experience. The most important thing as we think about AI for us is to be grounded in trust. We are also a highly regulated industry, to be in compliance, to mitigate risk, and make sure we do it in a way that is methodical. Currently, we are going through the process of investing in our data strategy to make sure we have high quality data. So when we roll out AI use cases, when we roll out solutions, it is grounded in a higher level of trust and safety for our constituents. We at Quartz are committed to digital solutions that are human-centered, with a culture of transparency, both with our customers and stakeholders, and continuously improving it. Because when it comes to AI, the question isn't what we can do, but how do we do it? I'm sure all of us are debating the same topics. We all have some commonalities, no matter where we are located or who we work for, and it must be done in a very accountable manner. I'll be remiss if I don't thank the Wisconsin Health News, our fellow sponsors, and this incredible panel of experts for coming together to spend their time to share their expertise on the possibilities of AI. And also everybody who dialed in on behalf of Quartz and Wisconsin Health News, thank you for taking valuable time out of your day to be here. At Quartz, we are proud to support this dialogue and proud to be part of a healthcare community that's working to ensure digital progress is safe, ethical, and equitable for all. Tim, back to you.
Well, thank you. Thank you, Siva. Some great words to get us started on. And thanks again to Quartz for all of the generous and continued support. Thanks again to our panelists for sharing some of their valuable time with us today. There is certainly no shortage of events or media reports on AI these days. But it's been a couple of years since we've done an event on the topic, and things have rapidly changed since, and they continue to quickly evolve. So we thought it'd be interesting to check in and see where things are and where they're going and what's holding back further progress. As always, I have a long list of questions, so I am going to dive in. And Dr. Newman, let's start with you. As I mentioned, everyone's talking about AI and healthcare. Depending on who you listen to, AI is the most important development in healthcare since penicillin, and it's going to reshape healthcare delivery and primary care as we know it. What is, just to get us started, what is the current gap between hype and reality when it comes to AI and healthcare? Do you think AI is going to live up to its hype? Is it going to completely overhaul healthcare, or should we temper our expectations a little bit?
So I think 2025 has been the first year when we've transitioned from hype to help, where throughout my last 5 years, everyone's been saying AI is the next big thing. 2025 was the first year that we saw specific AI initiatives that have actually made a difference in my patients' lives. We've seen stuff such as ambient listening. We've seen some predictive models we've been able to operationalize that have actually been affecting patients' lives in a way that we've never seen before.
Thank you. Sean, what do you think? Is the hype real?
I think the hype is definitely real. I think especially if you think about longer term time horizons, I think we'll look back and say, yeah, for sure, AI at this time was instrumental in changing the way that we think about healthcare. I just think it's stair-step improvement. We do it piece by piece. We improve this aspect of healthcare and that aspect of healthcare. And I think especially, to Dr. Newman's point, I think 2025 is the year where we're seeing a lot of the rubber meeting the road. We're seeing a lot of use cases get traction. What we're seeing at Epic is folks are actually able to adopt AI at scale, which was and is still a barrier for folks. And we're starting to really collect those outcomes of how is it saving time, how is it improving lives, and I think that's really encouraging.
Excellent. Dr. Patterson, what are some specific ways that AI is being deployed right now at UW, including some of your recent success stories?
So I think when I'm asked that question, we started our AI journey several years ago now, and at that time, we're all talking about predictive machine learning models. And my guess is what this audience is interested in when they hear AI is this newer flavor of generative AI and large language models. So I'll say quickly that I think machine learning models are really kind of coming onto that really productive stage of the implementation curve, and a lot of good stuff is still coming that way. And we are doing a lot in that space. But I think people are interested in the LLM, so I could talk in that department. I think we're, like many health systems, really excited about using these tools to improve the lives of our providers and our patients. The sort of killer apps that you see nationally are ambient AI, which we are looking at, this ability of AI to generate notes from physician-patient encounters. We have been, for over a year now, using AI to help physicians and nurses draft responses to patients in in-basket messages using an Epic product for that has been working well. And what we're really excited about moving into in this year is this idea of summarization, using AI to go through big charts, summarize information presented to clinicians so that they can spend less time digging through the charts and more time talking to their patients.
Excellent. Dr. Newman, how would you answer that? You mentioned a couple of things already, but what are some of the specific ways that AI is being used at Sanford today, including some of the more recent developments?
Yeah, so we're over a year into our ambient listening experience, and it has been a massive, massive success. I do have some statistics to share. We started with 100 providers, and now we're up to between 200 and 300. And 100% said they would be disappointed if we took this away. In medicine, you don't achieve 100% very often. 88% reported an improvement in burnout or fatigue. That anecdotally, I've had friends that have been missing dinner for their whole life, and now they're at home with their kids. It's been a massive, massive success. We've also had success with some predictive AI. One of the hardest parts is change management. So predictive AI, getting it to the provider. So we can predict who's going to get chronic kidney disease. We've never been able to effectively operationalize it until just this year, when through some partnerships with Epic, we got it front and center. So now our primary care providers can know who's going to develop chronic kidney disease. These are the things that we have struggled with in the past, is operationalizing these things. But now we're starting to see buy-in with our providers.
And just to follow up on that, Dr. Newman, like how is that working in real life? Some of this predictive AI stuff that you're doing, specifically with Epic.
Yes, so it is a tool that we use. So while we haven't seen massive gains in, transitioning from stage 3 to stage 4 or preventing chronic kidney disease, we're seeing small gains in utilizations of ACEs and ARBs. We're seeing small gains in people adding to the problem list, so they're aware of this. Those are the things that are going to make big changes in the future. One thing we're very excited about is how widespread AI change management is becoming. So big journals such as the New England Journal of Medicine now have an AI journal. The Mayo Clinic has their platform, which is really digitally focused. These are the ways that more providers get trust in AI, and then they'll start utilizing that for their patients.
Excellent. Sean, what are some of the ways that AI has been used at Epic? I know it's a pretty long list, but what are some of the things you're most excited about, including some of these kind of most recent projects that you've launched?
Yeah, so we're pretty hard at work trying to find use cases really throughout our software, our healthcare software for artificial intelligence. We've been talking a bit about predictive models and have built up really over the last 7 years a library of predictive models, but the most rapid rate of change that we've seen in the last 2 years is definitely generative AI, to Dr. Patterson's point. Summarization, a great use case that we've found. So finding areas within the chart where we think it would be valuable for providers, for coders, for patients to just see an at-a-glance summary of all of that data that is, kind of disparate in the EHR today, hard to find. You have to know where to look, and just bringing that to the forefront for everyone in the team of care there. Automation is another huge area of focus. So finding avenues to leverage the critical reasoning capabilities of the modern large language models, the frontier models, and just using those capabilities to eliminate some of the friction points that are just in the healthcare system today, and try to free up time for folks like care providers to spend that time actually providing care to patients and less time in those friction points. So a ton of automation throughout our software to try to speed that up and make it easier for folks. And I think we have great plans to use this more in the kind of clinical decision support care providing space. We do think there's a ton of opportunity there, especially if we can leverage the data at Epic. We have a system called Cosmos, which is a de-identified research database, a ton of possibilities to leverage the insights from a database like that using generative AI. But I think we're so heads down on the lower hanging fruit that a lot of the opportunity that exists in the healthcare software today is not actually in the clinical decision support space. It's really in the simpler stuff. How do we speed up workflows? How do we find the right information? That's been our focus really for the last couple of years.
Excellent. Dean Chung, how would you answer that question? What are some of the specific ways that AI is being used today to help nurses?
Oh, absolutely. Given that the majority of the healthcare agencies in the state of Wisconsin and certainly in the Northeast Wisconsin are using Epic, a lot of the nurses and clinicians are exposed to all of the technologies that we have just discussed. And same goes to our nursing students or students in the clinical track. And through their clinical rotations, they have exposure to these technologies, and that's how they are learning about it. At the same time, at UW in the College of Nursing, we have developed custom GPT library using the generative AI technology, and now it's much more functional and it's really more natural at this point in time. What it really means is we have essentially developed AI patients or client avatars where it feels like you are interacting naturally with a real patient on a Zoom setting, similar to what we are having right now. And what we did is we actually are one of the first public four-year institutions to use Epic's Lyceum, which is the educational module or educational version of the electronic health record platform. And what we did is we essentially brought, and the Lyceum is filled with standardized patient charts. And what we did is we essentially brought them to life. So the students are able to communicate and do this health history taking with this client avatar and able to get that health history information from the avatar and actually document in Epic's Lyceum. So that's how we are actually using the generative AI technology in an educational setting to nurture future workforce.
Excellent. Dr. Newman, what are some ways that AI is not working? I mean, what are some examples of things that maybe you've tried and so far haven't worked well with AI?
Yeah, being transparent, most of the stuff we've tried hasn't worked. And the reason is because we didn't have a way to operationalize it. So we have predictive models that can predict diabetes, that can augment treatment for depression, but we haven't found a way to get provider buy-in. Sean used the term front and center, and that has been key for us. How do we get that information? How do we get the predictive analytics to the provider to make the decision? We've been able to do that through our chronic kidney disease AI. We've been able to put it right in, we're an Epic shop right in front of the provider Epic. So it's one of the first things they see when they go into the chart.
Great. Dr. Patterson, how would you answer that? What are some things that, at least for now, AI has not been a good tool for?
Yeah, so I agree with Dr. Newman. I think one of the biggest problems is when you have a technology, there's so much promise and there's been so much advancement in the past 2 years of what we could be doing, but there's a huge gap between we could do something, we could predict this, we could generate this text, and doing the workflow integration work to get that in front of physicians and nurses in a way that's going to change their practice. The literature is full of places where people build tools that are good tools. And if you have a bunch of physicians take a look at it in some external space, they're like, yeah, that's great. I would use that every day in my clinic. And then if you just dump it in their clinic, they're never going to touch it because you go into work and you just do what you were doing at work. And it takes a real value proposition to get people to change and a real awareness. And there's many ways we can screw this up as we bring these tools out, and small changes make a big difference in that workflow integration. We need to make these tools front and center, but not in a way that's obstructive, not in a way that people are being forced down pathways that don't align with the other work that they're doing. So, similarly, we've had some things that have worked well and some things that haven't worked. And the lesson that we've learned so far is that the technology is exciting, but we need to do that work just like any other tool of change management, making sure that people are educated and making sure that we've done the work to make sure the tool fits in the workflow the way the physician or nurse needs it.
So and Dr. Patterson, I'll stick with you for a minute, but what's next? I mean, it's already been talked about a little bit, especially kind of in the near term, maybe more work around predictive stuff. Kind of near term, maybe can you expound on that? What's next? And then a little further down the road, I mean, what are you most excited about, the kind of the potential of AI? Are we going to see like robots working alongside human doctors in the operating room anytime soon? What kind of most excites you about what's next for AI?
Well, I'm definitely excited. Traditionally, my predictions beyond 6 months start to really fall off in terms of what's going to happen. It's moved pretty quick, and it's still moving quickly. I think the story that we're seeing is this idea of building effective teams of humans and AI tools. It's not so much the human trusting AI to do something, not replacing the human with AI, but what's the best way we can use these tools? And if you think about the first places where AI has been really successful, there are areas where the human is intrinsically very much supervising the AI in terms of drafting a patient message, having AI write a note that then I would review and sign. These are things that you don't need to have much trust or much reliability of the system to still gain a ton of value. When we move into summarization, which is what I'm most excited about right now, and that sort of near-term change, a summary is something where a provider needs to have some understanding of the reliability of that summary to know how much to trust it. If I don't trust a summary, I just need to go and look at the information myself. And so that's a space where we're bringing that AI into the team in a way where it's a more reliable partner. And I think the expanding from there, assuming we, as summarization moves forward, then we start to think about even more reliable places where we could put AI in, and that's looking for individualized treatment recommendations, comparing patient data with curated sources of knowledge, things that we trust in terms of how we should take care of patients and being able to suggest to providers what the right next step is. That stuff is still pretty far down the line, but who knows how far it is given the rapid pace of change that we've been seeing.
Dr. Newman, what are you most excited about in terms of what's next for AI in healthcare?
So short term, it's quality and efficiency gains. So I work with providers every day that are burnt out. The other week I was on vacation, I was driving down the road with my kids, and we tried to figure out where to eat. And because we didn't know where we were, there's 20 restaurants, we couldn't figure out where to eat. Imagine being a primary care provider and you have over 1,000 pieces of information from your patients, and you can't figure out what's important or not. What AI is going to do, it's going to filter through all this information and tell you what the 3 to 5 most important things are, and it's going to put it front and center. So if a patient comes in and they've got chronic kidney disease, diabetes, hypertension, hyperlipidemia, depression, it can give you information on where to prioritize your discussion. We already have what the patient's #1 priority is through their entered comments, so we can start with that. But afterwards, AI will help us get through that. For radiologists, right now we can't hire enough radiologists. Can we use AI to augment their strategy so it can tee up a report so they can increase their quality and efficiency? These are the things that I'm looking to do in the next 1 to 5 years, not in the next 10 years, but in the short term.
And what after that? What are you most excited about? Kind of more longer term, further down the road.
So I'm very interested in healthcare becoming a very in-demand job, not because it has altruism baked in, but because it's fun to do, to bring the joy back in medicine. So that instead of being with a computer screen, you're with patients. And I think that is what AI will help us do. It'll help us be more efficient.
So I'm sure you're getting pitched on all types of ideas. There's a million ways AI can help, and it can be expensive. It can be expensive to put forth some of these technologies. As we're learning today, it doesn't always work as intended. Not everything is working yet. Dr. Newman, how are you choosing, kind of amidst all this, what to dedicate your kind of precious resources on right now in terms of AI?
So at Sanford, we're very problem focused. Is that if we don't have the answer to a problem, we're not interested in that solution. Right now, there's tons of cool technology out there. And what I am very focused on is not technology driving healthcare, but healthcare driving technology. So if we have a problem such as right now, we can't get everyone screened for colon cancer, that there's not enough GI docs and surgeons to do colonoscopies. How can we leverage an AI company to let us know who's appropriate for a stool-based colon cancer screening? How can we get that front and center? If the company has change management built in, that's a huge plus. So when we're evaluating potential partners, if they can say, oh, hey, we've done psychological studies, and this is what your providers want, this is when it's going to actually work, they'll go to the front of the list. That if we have a problem we're looking to solve and there's change management built in, it's an easy win for everybody.
Dr. Patterson, how would you answer that? How are you deciding what to focus on kind of right now in terms of AI?
So I think there's two strategies that we use together. First is, let's look at strategic priorities, big problems that we think AI could fix. That's sort of top down. Those of us who are in this world, what are we seeing coming from the technology side that we think is going to revolutionize healthcare? We want to be on the early side of that. We want to be able to, be taking advantage of these technologies for our providers early. But then that has to be coupled with the sort of bottom up. What are the people who are asking for solutions that AI can fix? Where we have people within the organization who are saying, man, I do this same thing over and over any day, and it seems like a task that maybe we could automate. Is there some way that we could get some help with that? And so our team is often meeting with providers to say, hey, is this a place where there is a solution that exists or that could be developed where we could use AI to help make your life easier?
Chung, what are you most excited about in terms of the potential of AI, in terms of what's next, kind of specifically looking at the world of nursing?
Sure.
Yeah.
I am most excited about the potential of using the technology to really, at the end of the day, empower the educators and both clinicians to really provide that customized, personalized health and customized, personalized education using all of this information that is summarized to meet the needs of the individual learners or individual patients. And that is what I'm most excited about, that we now will have soon potential and capabilities to offer that. In terms of, you were asking about robots and how that might influence we all know that AI has been around for a while, but it's really the generative AI and the language model and the natural language processing that has been more of the impetus towards some of these more exciting developments in the past recent years and into the future. And so adding generative AI technology to existing robots that are surgical robots that are enhanced by generative AI, and those would be exciting. The other thing I would add is that that all of this will be further augmented by personal devices and wearable devices that will help monitor health metrics and that will help symptom checks at home and even beyond the walls of the hospital, and also enhanced through those remote consultations, remote education, and even 24/7 support that is enhanced through AI. Those are the additional pieces that would really excite me towards providing those personalized education and personalized healthcare.
Excellent. Thank you. Sean, how would you answer that? I mean, what are you, Epic's working on a ton of things. What are you most excited about in terms of what's next, in terms of the potential of AI in healthcare?
Yeah, I mean, I'm super excited for basically everything. I think there's a ton of opportunity, and I think a lot of the other panelists called out a lot of that opportunity. I will add one of the things that personally excites me is some of the work that we're doing for patients directly. I think a lot of the generative AI functionality that we have planned and in the works is really designed to help patients have more agency in their own health journey, better understand the data in their system, better understand what options they have when it comes to taking advantage of healthcare. And I'm excited to see some of those roll out to MyChart through our patient portal, so that everyone can benefit. We want to see health systems benefit, we want to see doctors and nurses benefit, but we also want to see patients benefit from this technology.
And can you, I know it sounds like it's still being rolled out, Sean, but can you just expound on that? What that kind of look, this patient-focused technology?
One of the things I think from a development standpoint that we're really excited about here at Epic is agents. Agents are now kind of the new paradigm when it comes to LLM development. And one of the things that agents can afford is flexibility in the tasks that they can take. So we're not having to think about where in a workflow do we want to generate a summary, or when do we want to draft a end of shift note, for example, which are kind of very specific use cases of generative AI. We can kind of reframe the question to be, okay, what are the questions patients want answered? What are the questions that I might have? Okay, I want to ask about information in my chart. I want to ask to schedule an appointment. I want to ask, what's the next step? What was the provider saying when they said X, maybe a medical term that I don't understand? Those are the sorts of questions that patients ask. And you could have a single agent, sort of like a chat GPT in your MyChart that says, I'm going to answer that question that you have, or drive an action in the system, maybe schedule an appointment, maybe send a message to the care provider. And I could do all of that for you. I as an agent can take that action on your behalf. And I think that's going to open the door for a lot more personalization in medicine. And it's going to open the door for a lot more, patients being there, being an advocate for themselves in that healthcare journey.
Excellent. Dr. Patterson, it seems like, a lot of the initial success, emphasis right now in AI in terms of what's been rolled out already is on freeing up providers' time, whether it be some of the ambient listen stuff or as you said, you're excited about going forward, more efforts to summarize all the information out there before you see a patient. What is the goal of all that I guess, what's the goal of that? Is to spend more time with each patient? Is it to see more patients? What about that excites you kind of the most?
I think I'm excited about not just spending more time with patients, but what we talk about a lot is providers, both physicians and nurses, working at the top of their license. this idea of spending less time doing tasks that they didn't go into healthcare to do and more time doing the things that they want to do. And part of that is more face-to-face interactions with the patients, but part of it is taking the time to make the decisions that, for now at least, are beyond the scope of the AI, and making those complex calculations with all the data that you need in terms of what's the best thing to do for this patient. You've got all the patient's comorbidities. You've got a conflicting set of recommendations from different professional societies. You've got individual patient characteristics in terms of their goals of care, what they want, and being able for me to take in from a patient, hey, what do you want to do? What are your goals? And taking less time to think about some of that other stuff allows me to tailor a better plan of care for that patient. So that's what really excites me.
Dr. Newman, a lot of hope around AI is to help, and it's already been mentioned today, to help alleviate some of the persistent workforce challenges that healthcare continues to struggle with. Can you just talk a little bit about the kind of the impact that you think AI can have on healthcare? Do you foresee this potentially replacing healthcare jobs that where shortages are the greatest going forward? You talked about the big shortage of radiologists. Going forward, will we always need a radiologist to examine medical images if AI can do it better and quicker?
Yeah, I think that it's not going to replace a lot of jobs, but it'll augment a lot of jobs. So Dr. Patterson, I loved what he said about helping people be at the top of their game. So what I'm excited about is how in rural America, if we've got workforce shortages, so if we're in a rural community and they just have a nurse practitioner or PA, how can we help them be at the top of their game? In the past, it was through books, right? So nobody buys books anymore in medicine. It transitioned to all online modules, looking up things online. And in the future, it's going to be AI. It's how do you utilize AI to help you be at the top of your game? A patient's coming in, it's trauma. How can you, put on a VR goggle that's using AI and helps you walk through how to do a chest tube? What are the 3 questions that you need to ask if someone's coming in a thyroid storm? Those are how AI can help every single provider be better for their patients and serve more patients at the same time.
Dean Chung, where do you see AI having the biggest impact on workforce challenges?
For nursing workforce, as Drs. Patterson and Newman mentioned, it comes down to allowing the nurses to practice at the full scope of their license and be able to essentially remove some of those repetitive tasks that does not have to be done by nurses. There's a lot of administrative work that nurses do or clinicians do, and that is actually a key factor for clinician burnout and dissatisfaction, and essentially leaving the workforce at the end of that. So with the AI support and augmentation of the capabilities of clinicians, freeing them up from those repetitive administrative tasks to focus on what fulfills them and what brings them satisfaction to practice as a clinician, which is what they wanted to do right from the beginning, it would really help with reducing the burnout and helping the workforce stay in the workforce and practice up to their full scope of license.
Thank you. Sean, and this has kind of been talked a little bit about already, but what do you see as some of the biggest barriers to moving forward even further with AI? Is it accuracy? Is it provider knowledge? What do you think are some of the biggest barriers right now to going forward even more?
Yeah, I think so. What we've seen as our Epic customers, Epic Health Systems have adopted AI, generally the biggest blockers tend to be operational. It tends to be, do we have the right buy-in, understanding the right workflows for folks to use the technology? Is the technology accurate enough to really start to develop trust with those folks? And then is it in the right place at the right time so that they can do it in a seamless and time effective way. And I think it's something that we've had to sort of learn as we go. Working with generative AI is a construct that didn't exist 4 years ago. And so we've had to learn, okay, where are the best places for that human computer interaction? How do we best show citations, for example, to start to build that trust with folks? It's meant a lot of time spent with kind of at the elbow type research with providers using it, getting feedback, iterating on the technology and how it's displayed. And I think we're still working through that. I think the more that we can build trust with folks that the tools work and work effectively, the ways we can show that in the system, the easier that adoption is. And I think it gets down to, these tools. I think everyone agrees that the problems that we're trying to solve with these tools are problems that ought to be solved. And I think everyone is excited to solve them. I think the challenge is always, the rubber meeting the road and having trust in those solutions.
Dr. Patterson, what do you think? What do you think are the biggest barriers right now to AI?
So I agree completely with Sean that a lot of these barriers are operational. The idea that, as we talked about earlier, like the technology has moved so quickly that the change management of just moving things that inertia is hard. But the other barrier that I'd highlight would be the barrier of measurement. I think right now, as we move into these higher trust areas, the tools need to work, and we need to be able to communicate to the clinicians who are going to use them how they work. Nothing's perfect, and these things are going to have some strengths and some weaknesses. And right now, we just haven't developed the language yet to measure these things and say apples to apples, this thing works better than that one. When we roll out a new medical test, we say it's XX% sensitive and XX% specific to detect this disease. And that lets me as a physician say, okay, this is how I'm going to use it in my practice to improve care. And we're still working to get to that point with a lot of these AI solutions. And until we can talk in that language, it's going to be hard to get providers to intrinsically incorporate these things in their sort of mental model of how they treat diseases.
Thank you. Dr. Newman, what would you add to that? As we race ahead with AI, what are some of the barriers that remain?
So I think the term that both Sean and Dr. Patterson used that I really like is trust. Is until both providers and patients have trust in the AI, it's not going to go anywhere. We've got to be transparent about it. We've got to emphasize that AI is supporting clinicians' judgment, not replacing the clinician's judgment. That as we go forward, we're going to have to show evidence for these things. The same way that we wouldn't treat a patient with a new medication or a new surgery, we're not going to treat them with a new digital therapeutic if we don't have evidence that it works. By having the evidence and by having that relationship, we're going to continue to build trust.
Dean Chung, what would you add to that? Well, what are some of the barriers that remain to go forward with AI?
I echo with everything that has been shared. What I might add is that the trust is not only with the clinicians or the staff in the healthcare environment, but also the patients, because patients and clients also need to be able to trust the care that they're receiving or the recommendations they might be getting from an AI tool. And the other thing is the fact that how nurses come into the picture. And because, when we think about where the rubber meets the road, oftentimes the clinicians are the ones, including nurses, are the ones who are actually interacting with the patients, providing that education and training related to what they would be able to do to continue providing self-management of care at home. So how nurses can really be there to be at the moment of where the rubber meets the road and build that trust and try to explain how things work, and also be including patients in those conversations so that there is partnership or co-designing, so to speak, when it comes to moving things forward.
Dr. Newman, it seems like every month we read about a new health system that suffered a cyber attack. How is that? I didn't hear that mentioned as a barrier by anyone, but how is that increased risk impacting what health systems are doing in terms of how they're rolling out AI?
Oh, it's a massive, massive risk. And if you're not thinking about it, you're kidding yourself. That one thing that we have at Sanford is we have AI governance. And so nothing can get introduced to our system until it goes through a multi-layered approach that has not only clinicians involved, but it has cybersecurity, it has rev cycle, it has different administrators. It's got everybody involved to make sure it's not only safe for the patient, for the provider, but for the system. That we don't let individual clinicians or nurses bring their own AI devices in because of that risk of cybersecurity. That every single digital touch point that comes into our system carries that risk.
Sean, a lot of these AI products run on patient data. Is there a concern that as this increases, this creates new vulnerabilities for hackers to exploit?
New vulnerabilities, I actually would say no. This is maybe a hot take. I think designing software for security is nothing new to Epic. It's nothing new to our methodology. And the fact that the technology is AI doesn't change that. Um, However, I do think there is I think the ability to generate malicious code has gone up tremendously with generative AI. Much like we can use generative AI to write hopefully good, secure code, I think bad actors are using it to write malicious code. And I think that is the concern. I would say it should not feel like more of a concern than it did 4 years ago. Maybe there's a bit of extra urgency because the bar has been lowered, but the recourse for a health system that would be worried about that security is much the same. It's make sure you've checked the boxes, you have dotted your I's, you've crossed your T's, you've got the right network security. And the fact that you're running AI within that should not change that story.
Dr. Patterson, how do we ensure that we also don't leave patients behind? I mean, AI can be pretty expensive to develop. Big systems like UW have more resources. They're the ones that are, for the most part, taking the lead on developing AI. While not as much is happening in federally qualified health centers or smaller systems or smaller hospitals that treat a lot of patients with lower incomes. What do you think needs to be done to mitigate any digital divide when it comes to AI, to make sure that only that we don't just have a certain population benefiting from AI?
Yeah, this is a good question. I think AI is similar to a lot of other healthcare technologies where things are going to be rolled out in big academic medical centers first that have the resources to prove these things are safe and feasible before they become something that's rolled out in other places. But certainly the excitement around the benefit that AI provides makes that seem much more acute in this particular area than others, in terms of if it's some new drug or some new assay, it's not as monumental of a change. And I think a lot of people are thinking about what are the ways that we can make sure that the type of governance which is the important thing to get these things across. How do you recreate the type of governance that big systems are using at smaller areas? And how do we give smaller systems the tools to be able to evaluate these things and make sure that they're safe? I think there are a lot of folks who are working on this in terms of both academic centers through how they publish things openly to say, hey, this is how you can use things, the sort of traditional publication channels. There are also organizations that are dedicated to bridging this divide. And there have been some federal efforts, although with the change of administration, that's been kind of an up in the air piece. But there have been efforts to talk about, like, what is the regulatory system to say that AI is going to be safe in a given place that would give more resources for smaller systems to adopt these tools.
Yeah, I would agree with Dr. Patterson on that. I think that it's the bigger, larger academic centers, it's kind of their duty to be the cool older brother and help out everybody else, right? So at Sanford, we've got Epic Community Connect, where we help critical access hospitals, we help smaller rural hospitals with Epic and with technology solutions. And we feel it's really our duty not to help just our own patients in rural America, but every single patient in rural America.
So, Dr. Newman, another concern is that the data being used to develop these models doesn't always accurately represent all patients. And this could lead to a further exacerbation of health disparities, which is a really big deal here in Wisconsin, where we have some of the widest gaps of anywhere in the country, but it's a big deal across the country as well. What impact do you think, if not done right, AI could have on increasing health disparities?
Absolutely. So we are very fortunate that we have a large enterprise data analytics team that can take our own algorithms with our own patient data to see if there's bias in that. That we've seen with a lot of the large AI models, there is bias, but who has the data? So if it is us in a rural footprint, maybe we don't have enough African Americans in the model to validate it. So how do we challenge our own data to make sure that it's clinically relevant? And how do we challenge other people's data? So how can we join a consortium of across the world so to know that for whatever patient's data is being fed into the algorithm, it's accurate? That's a great question, and we don't have all the answers, but we're looking at it.
Dean Chung, do you have anything to add to that? I mean, what needs to be done, or what is being done to ensure that the data that's used to create these models doesn't further exacerbate the health disparities that exist in healthcare today?
Sure. As a dean of an academic unit, what we are doing is to ensure that our graduating nurses, who are our future workforce, understand what the AI technology involves and all the concerns that we had mentioned about that be digital divide, that be health disparities, or the bias intrinsic in some of these models due to the data that is being used. We are trying to educate our students so that they are informed about these potential biases, so that they can be empowered to participate in some of these governing bodies that have been previously mentioned, so that they can advocate for patients, or when they're educating the patients, oh, you should be using XYZ technology. Well, do they actually have access to the technology or the internet or the bandwidth to be able to utilize some of these devices or technology that might be out there but not available to them. So that is how we are preparing future workforce to be involved in the conversation and think about how to advocate for patients.
So we've it's been mentioned today. It's talked about a lot when we talk about AI. Regulations around AI. Sean, do you think regulations around AI are needed? Why or why not? And if so, what type of regulations do you think are needed for AI?
Yeah, I think the case for regulations is right now people just don't know. And I think really kind of good common sense regulations would go a long way in just helping people develop that trust that we talked about as so important for adoption. And I think that's ultimately what everyone wants to see is we want to get this technology in a safe, effective way out as fast as possible. I think what we have seen, I'm certainly not a lawyer, so I'm not going to say I am as in the weeds as the other folks here are at Epic. But what we've seen from states' legislatures that are coming out with AI regulation has generally been pretty positive. And I think what we look for is transparency almost above all else. I think any regulation that's pushing for transparency of model performance, of what the tools do, where the data goes, I think generally folks are for. One of the things that I would say we at least have been keeping an eye on is this concept of validating AI in vitro, so to speak. And I see Dr. Patterson shaking or nodding his head. I know he and I have had this conversation with respect to some of the Epic institutions validating AI, which is our perspective is always validation is done best at a local setting. It is far better to see quite literally how AI tools are performing at each health system on their patients, on their data, versus just saying, hey, this AI was validated in some black box on some black box data set, and that is the sort of mechanism for safety. So our focus has always been democratize as best we can AI governance and AI validation tools to make it easy to say, for each health system to say, yes, this works for us, and they don't have to rely on some third party that certifies AI broadly.
Dr. Patterson, can you just kind of, this, in terms of AI regulation, it isn't completely the wild west right now. Could you just kind of briefly summarize some of the regulations that do exist, and then what do you think is more needed, and if so, why?
Yeah, that's a good point. Often people come to me and say, "Oh, there's no regulation," and I think the idea that there's a coordinated, simple set of rules that everybody's clear on is certainly there's a long way to go. But there are a lot of regulatory actors out there, and especially for providers and patients to understand that we are thinking about this stuff. The three groups that I bring up most frequently are, the FDA is regulating AI products that function as a medical device. So things that are going to diagnose or treat a disease, interpret a signal. There's a whole set of rules that say this is a medical device, and then you're going to have to go through FDA clearance. But there's a lot of things that don't fall under the FDA's regulation in terms of some of the administrative tools that we've talked about. There's an office called the Office of the National Coordinator, the ONC, that broadly regulates electronic health records. And they have a lot to say about how AI should be labeled and a lot towards the transparency type goals that Sean was discussing. And then importantly, the Office of Civil Rights is very interested in AI in healthcare because of these potential discrimination issues that we've come up with already. So there's part of the Affordable Care Act that the OCR enforces, specifically bars systems from using algorithms which discriminate across any number of characteristics. And as a hospital system, in terms of responding to these regulations and making sure we're in compliance, part of that is having that good governance where we know every piece of AI that's running in our system, we know what the inputs are, and we have the ability to monitor how these things are working to show that they're not necessarily, creating any new disparities, or to show that they are acting as their plan. So if one of these regulators came by and asked, "What are you doing?" we're able to talk about our plan.
Dr. Newman, is that enough in terms of regulations, or do you think more is needed as this technology continues to rapidly evolve?
So what I think people forget is that, so everything Brian said is phenomenal, that we've got multiple layers. Besides everything that's happening at the governmental, kind of the federal level, is hospitals have their own systems. The same way that at Sanford, we wouldn't credential an endocrinologist like me to be able to deliver babies because I'm not safe. I'm a doctor, I've done it before, but I'm not safe to do that. We're looking at these digital therapeutics with the same lens. We look to see what the federal guidance has been, and then we interpret that to make sure that it's safe for our patients. We also want to provide our doctors and nurses and APPs the tools to help provide that trust to know that there's oversight. So just the same way that we're not going to give a patient an unsafe medication, we're not going to give them an unsafe digital therapeutic.
Do you think that more needs to be done, though, in terms of coordination? So you have your set of guidelines that could be different maybe than, a system out west or out east. Do you think more needs to be done to have kind of more of a uniform set of guidelines, or do you think it's okay kind of the way it is right now?
So I think using the term guidelines is good, and that we can agree to disagree on things as well. That just the same way that, guidelines are a guide for you, it's not right for every single patient. But there needs to be more, I guess, transparency among large organizations on what they're doing, because we don't want to recreate the wheel. We don't want to create inefficiencies based upon us not data sharing. And we're really in the infancy of this right now. That this is a very, very new technology, and we're going to make mistakes along the way, but eventually we'll figure out what's best for the patient and for the providers.
And do you think, like right now, policymakers should step in and do more, or they should maybe kind of hold off? And
I think they're doing a pretty good job. I think that they are understandably skeptical, and that they're asking the right questions, and they're involving the right people at the table. That at Sanford, we've been involved in some AI task forces at the federal level, and we're happy that we're being asked. That I think that people get into trouble when they don't ask the right experts. And right now in the United States, we're asking the right experts.
Excellent. So we are quickly kind of approaching the end, but to kind of sum things up, and this has been talked a little bit about already, but AI has rapidly changed in the last couple of years. It's likely to change even more rapidly in the years to come. In the time we have left, could each panelist take a minute to single out, if you had to pick one, what is one of the most significant ways that AI will be impacting healthcare, 5 years, 5+ years from now? And Dean Chung, let's start with you.
Sure. I would go back to the personalized precision medicine and personalized education, utilizing all of the different technologies and opportunities, possibilities we have just discussed, really being able to afford the educators, clients, and patients access to care that is personalized to them, allowing the clinicians and healthcare agencies to provide care that is personalized to the clients. That would be the part that I'm most excited about and look forward to seeing it come to fruition.
Excellent. Dr. Newman, what do you think is one of the most significant ways AI will be impacting healthcare 5 years from now?
So I'm an absolute realist. So let's go to like 2 years. I think that ambient listening is going to take over. It's going to be the expectation, and it is going to make the expectation that I have an actual relationship with my patients. That instead of having a relationship with the computer screen, I will be able to look at my patients and have a relationship with them.
Dr. Patterson, what do you think?
So I think that right now we're very excited about using these AI technologies to automate and make easier the tasks in healthcare that we find onerous. But I'm really excited about this idea that as we get out to that further timescale, 5-10 years, we're going to start using AI to replace those workflows with better ones. Like going from, we need ambient to write this. Right now, we're very focused on writing a bunch of stuff down. But if we have AI systems that are able to give us information whenever we need it, we may not need to even think about storing it in the same way.
Sean, we'll give you the final word. What are you most excited about? What do you think is one of the most significant ways AI is going to change healthcare?
Yeah, I think kind of jumping off Dr. Patterson's comment, I think if we've done our job right and providers see the AI that we hope that they will see in that 5-year timeline, it becomes a trusted colleague. It becomes a thing that you can ask questions of and get answers from far more data than you as a human can see. You can use it to drive action in the system. You can ask it medical questions and it gives you medical answers. And I think that's the future that we're trying to build for providers, is that they have this digital colleague that is the system that the EHR has become.
Excellent. It's a good word to end on. Well, thank you guys. This has been great. I learned a lot. I hope all our attendees learned a lot. Thanks for sharing your time with us today. Thanks to our generous sponsors for making this possible. Hope to see you all at the next one.